Hi, how are you going? My name is Dr. Clive Jones, and I'm here to talk to you about the counselling interview, but more importantly, the communication process that underpins the counselling process and the counselling interview. So we're looking at an introductory review of communication that occurs within counselling. And then also, once we go through those things in an introductory way, we'll then look at the counselling interview and see, as a general overriding guide, how the communication process fits into the counselling interview. And so it's a good, it's basically a great introductory overview of communication. And some of the things that are involved in it in order to encourage effective communication. Just a little background on myself. I'm a registered psychologist. I'm a member of the Australian Psych Society, the Australian Psych Society's College of Counselling Psychologists, and also the College of Sports Psychologists. I'm a practitioner and also an academic. I lecture in psychology and counselling, writing programs and subjects in the area and teaching in the area. I also practice broadly in clinical loads, counselling, and also in sports psychology. So a broad range of therapeutic applications that I have as a practitioner. Okay, what I would like to do is just introduce the sections that we're looking at. The first section that we're looking at is overviewing the communication process or how to communicate effectively while counselling. The second, we're looking at specific micro skills. Now, it's not an all-inclusive list that I'm going to be looking at here, but just teasing out and picking out some micro skills that are important as a foundation of the communication process in counselling. And then the third section of this talk, I'll be looking at the counselling interview, as I said before, and breaking that up into stages, into 5 stages that we'll be looking at. Okay, so firstly, communicating effectively and overviewing the communication process, breaking it right down to its fundamentals. The first 2 terms I'd like to look at is encoding or encoding and decoding, and obviously a lot of you would have heard of those terms before. And encoding is the part of the communication process that where we encode things into symbols and messages or words. Okay, so what are we encoding into symbols or messages or words? Well, it's our ideas, our feelings, our concepts, anything that we have within ourselves as a feeling, as a concept, as an idea. We have to encode it in order to communicate it. We have to put it into some form that we can then present to someone else in order for them to gain an understanding of what that thought, feeling, concept or perception might be. And so we can have symbols, we can have messages, we can have words in order to communicate. That's encoding, and it's quite a complex. Even now I am encoding information because there are concepts of what I have about the word, and I need to encode it into words so that you can understand what the concept I have of the word encoding is. And now often we'll find that what we have inside ourselves in terms of feelings and concepts and ideas and perspectives, they can be quite broad and quite cryptic as well. And so it can actually at times be quite challenging to encode that information that we have within ourselves into a form that somebody else can understand. And so in order to be a good communicator, we have to be able to encode effectively. We have to be able to structure that stuff within us in a way that can be presented. So that's encoding. And then we have decoding. Now, decoding is on the part of the listener, and the decoding is that process of transforming messages back. And so the stuff that's been encoded, that's in some sort of tangible form, that is externalized and given to someone else, okay, that's the encoding component. It comes back into, through the eyes, the senses in some form. It comes back to the person who is listening, who has to then decode it. And that means breaking it back down into the concepts, the perceptions, the feelings and the ideas and the meaning of that. And so when we're decoding, we have to work hard at understanding the true meaning of the message. So you can see, okay, it sounds simple enough, but it's quite a complex skill, and it's something that develops continually over our life in order to be able to communicate effectively. It's something that we can always improve on. And obviously, communication in counselling is the blood flow. It's in the arteries and the veins of life. Communication, without it, the counselling process doesn't work. And so to be able to encode effectively and decode effectively is vitally important. All right. Very practically, I'd like to just talk about some things that relate to the communication breakdown, things that can spoil the process of encoding and decoding, or things that can create barriers to effective encoding and decoding. And I'll just go through them now. There's quite a list, and it's not, again, an exhaustive or extensive, it's not an inclusive list of everything. Okay, so the first is if we're criticising. These are very practical areas in terms of encoding. If we want somebody to understand, we've got to be careful when we're communicating, or even when we're decoding. So not just speaking, but also when we're decoding and reflecting back our understanding. In terms of being overly critical in the message we send, or in our interpretation of what we hear, being overly critical can certainly be a spoiler or a barrier to the decoding and encoding process. It's very important that when in the process of communication, we come to a place of wanting to understand as opposed to judging, particularly in the therapeutic process. It's a process of understanding. It's a process of accepting a person as they are, irrespective of whether we agree or disagree with the client and their position and their perspective. And so it's important that we are not critical in our encoding and decoding, but we're wanting to understand. Obviously, another thing is name calling. If we send messages that could particularly undermine a person's perception of themselves, then it really puts a person in a place of defensiveness, where rather than being in a place of wanting to understand, they're wanting to be in a place of self-protection. And so we have to be careful in how we communicate any issues of concern that we might have, or when we're listening to things that may evoke within us certain feelings, that we don't cheapen the dialogue with name calling. And these are things that obviously we need to do as effective counsellors, not get caught up in these sorts of games. But it's also important for when we are listening and wanting to decode. Clients may communicate in this sort of way, and so it might become a spoiler or barrier for us in really being able to understand the client, because it might push a few buttons within us. And so when we're aware of these things on a number of levels, it can play a part in helping us in the communication process. So then the next is excessive and inappropriate questioning. This is an aspect of counselling that can be a big trap for counsellors to bombard a client with questions. We have to be careful of that. Excessive questioning can start to have a person feel like they're in an inquisition. They can potentially start to feel like they're being judged or evaluated when the questions just keep coming. Questions, when used appropriately, can help the person feel like you want to know them more. because you're making inquiries about their life, about how they feel, what they're thinking. And so a question, when used correctly, is going to have the client feeling that you really are respecting and appreciating and valuing who they are and want to know more about them and their situation and the issues. But too many questions is going to cause a problem. It could be a barrier or a spoiler. It could have the client withdrawing and feeling that they're being pushed into a place of exposure where they don't want to go yet. And so we've got to be careful about the questioning. Diagnosing is another difficult thing. Now, in the mental health profession, the concept of diagnosis is a significant factor, but there is a lot of debate over how to diagnose, when to diagnose, what to diagnose. A lot of debate on that, and so we're not just talking about diagnosing a clinical disposition or state of being. We're talking here really though about the concept of being diagnostic in our tone of response, being diagnostic whenever somebody is communicating something that we feel like we've got to give back the answer in some form or give back a summary of the problem and give them the answer. So we have to be careful in terms of diagnosing, saying, oh, well, this is what has happened. Okay, well, this is why it's happening. You know, it's answering too much too soon. We can obviously start to look like a know-it-all. And also what can happen is that when a person is diagnosing, the person who is subject to that diagnosis can often feel stereotyped. And so, again, I'm not here to debate the issues of diagnosis and the place for it. That's not what we're talking about here. We're talking about just a general disposition in the decoding of information given when the client is communicating, where we might fall into the trap of diagnosing and putting boundaries and labels to just about everything that's said. So we have to be careful of that. Another spoiler or barrier is praising evaluatively, where we praise, but it has an undertone of condition to it, where the person feels that, oh, okay, so this is what I need to do to get your approval, or this is what I need to do to get your acceptance, where the evaluative aspect of a praise or an encouragement could be in such a tone where it places or emulates a condition and starts to show the person where your judgments are, and in regard to what you like about a person, what you don't like about a person, what you respect and what you disrespect. So evaluatively praising in the therapeutic process in particular is not necessarily an effective thing. For example, oh, you know, isn't it great that you the way that you communicated with your partner there seemed really, really effective. Yeah, it's a terrible thing when partners just shout at each other. It's horrible. You know, they should never ever do that. Okay, so that's praise, but it's got an evaluative tone to it as well. Advising. Okay, and so a lot of folks getting into the helping professions, the mental health helping professions in counselling and psychotherapeutic work, can think that advising is what they're there to do. And again, because here we're introducing fundamental concepts through this particular video session, it's important to point out at the onset, because I'd imagine this is an introductory video, there'll be a lot of people, you know, considering and looking at counselling as a profession rather than being in it for many, many years. So the concept of advice is not something that comes readily in the counselling process. We are there to facilitate and encourage change through a process, but advice giving is not the major area of dialogue within the therapeutic process. To be caught up in giving advice can really squelch a person sharing. Often a person is just wanting to be heard and understood and accepted for who they are and what they're feeling, not to be given advice. Giving too much advice can also debilitate the client's sense of autonomy and self-efficacy in regard to their capacity or sense of capacity to deal with the situation. So we have to be careful about how we use advice. It can really spoil the communication dialogue. Ordering is certainly a no-no. To order somebody to behave or function or feel in a certain way is a big spoiler. Diverting from the essence of the communication, particularly if somebody is communicating something and then in our communication back to clarify whether or not we've understood, if we start diverting, it obviously just shows that we're not interested in what they have to say. Threatening is a definite spoiler and a barrier to communication. If we threaten, a person will feel threatened. And if a person feels threatened, they'll usually back off from wanting to communicate. Logical argument is also something that can be a spoiler or a barrier at times. To simply argue at a place of logic that doesn't take into consideration the other person's feelings. Because what might seem logical to us from the perspective of the other person might not seem logical. Logic is often relative to the individual's own perception and belief and value system. And so logical argument can sometimes frustrate and obviously again spoil open dialogue and communication. Moralising is something that can be a problem as well, to get on a soapbox and to just communicate passionately personal morals and beliefs and values without any consideration of what the other person might value or believe. It's certainly a spoiler. And excessive reassuring as well can be a spoiler or a barrier to excessively reinforce the person that's dialoguing. It can be sometimes a little bit condescending. It can also, in a sense, highlight your own insecurities, not being able to sort of sit in the ambiguity of a difficult situation if you're constantly needing to reassure the person. Often it's, if we're feeling the need to reassure the person, maybe it's ourselves we're wanting to reassure rather than the person. So we have to be careful about that. Now, they're communication spoilers. What I'll talk about now is just very quickly go through some of the negative responses from spoilers or barriers that come up. If we use those things in the counselling process, then there's going to be some negative, implications that come as a result, and a person can feel resentful if criticised, if being called names, if there's excessive or inappropriate questioning or diagnosing or any of the barriers that I've just mentioned. A response to it could be a feeling of resentment. There can be feelings of defeat as well. If somebody is overpowered by the other person's spoilers or barriers, if the person is feeling overpowered with the diverting, the ordering, the advice giving, the evaluative praise, the diagnosive tones, the inappropriate questioning, man, you put all that together, and it's understandable why some folks may feel defeated in that process, defeated in being able to really have a healthy and effective communication and dialogue. There can also be feelings of inadequacy. If a person, through these spoilers and barriers, may start to feel misunderstood, may start to feel judged, may start to feel that what they have to offer and say isn't really worth much in the context of the spoilers and barriers, and so therefore a person might start to feel inadequate. It will also reduce the likelihood of the person expressing their feelings, because if any expression just brings about those spoilers or barriers in terms of criticising, moralising, logical arguments, diverting, ordering, all of those things, then a person is going to back off from wanting to express what they really feel. And it'll also reduce the likelihood of the individual finding their own solution to their problems, because through these spoilers and barriers, the person using them is taking control. And so the person is going to feel manipulated, they're going to feel defeated, maybe resentful, inadequate, back off from expressing their feelings. It could also encourage an excessive dependency and, as I was saying, withdrawal, not just from expressing feelings, but withdrawal from the relationship. And in a counselling process, that could mean just not showing up to appointments anymore. And potentially as well, resistance, where the person may, build up a sense of trying to put boundaries to those things by resisting. And so resisting the advice, the diagnosis, resisting answering those excessively, questions, those sorts of things. So there now, with the whole aspect of communication, we've got the encoding, we've got the decoding, and then there's the risk of all, some of those spoilers or barriers that can come in the encoding and decoding process, which we really do have to be careful of. So there's other things too that can not so much get in the way, but we can impact on in some way the encoding and decoding process, and even things like culture and personal experiences and life experiences and even types of training, educational background, because educational background develops certain knowledge and understanding, and so there's a whole range of different things, personalities, ways of generally approaching life and doing life, and which comes from cultural influences and family influences. All of these things are going to make two people who are in the process of encoding and decoding information and heartfelt stuff being shared, all of those things is going to put them in a different place where they have to meet up eventually in a mutual understanding. And so all of these things need to be taken into consideration as well. The capacity to accommodate individual differences, to clarify how different values and beliefs and experiences, and to be able to accommodate those things. And the more we are open to accept and understand and respect difference, then the less we're going to be likely to fall into the traps of those spoilers and barriers that I was talking about before. So accommodating individual difference is very important. Now, we're going to move on to some micro skills, and the specific micro skills, this is section 2, and then we're going to move on to section 3. So I've talked about overviewing the communication process, which was the first section of the talk. I'm now moving on to the second section, which is looking at some specific micro skills. We're going to be looking at things like attending, questioning, responding, noting and reflecting, client observation, confronting, focusing, and influencing. And so that's what we'll be looking at in this second section of the talk. And then we'll be moving into the third section, which is getting an overview of the interview process. So let's have a look at some micro skills. First of all, attending. To attend means to give attention to pay attention to focus on. It takes effort to focus on something, to concentrate, to give our efforts and energy to attending to. So when we attend in the counselling relationship, when we are attending as a first point of communication, when the client is sharing, what we're doing is we're showing that we're interested in what the client is saying, and we need to have a congruence when we're attending. We need to really want to attend. We want to be there. We want to be listening. We want to hear what the client has to say. And so to attend can be prompted from a natural desire to want to know the client and understand who they are and what they're going through and how they may like to work on the issues that they're facing, whatever they might be. Attending is used through the entire counselling process, and it's probably one of the things that could tire a therapist out more than just about anything else. To attend to the dialogue, attending means effective decoding. The more we can attend, the better we attend, then the better place we are to decode effectively and really understand what the client is saying. But it certainly takes effort, a lot of concentration and focus. We don't just attend to the words, because when a person is encoding, there's encoding that's done at a conscious level and encoding that can sometimes ooze without necessarily, or at an unconscious level, without necessarily the client really intentionally being aware of that. And so body language, for example, even the tone of voice, facial expressions, all of those sorts of things we need to attend to, not to try to read and diagnose. What does this bit of body language mean, or what does that facial expression mean in that sort of diagnostic spoiler barrier way. But no, we want to attend because the motive in effective congruent attending is to really want to understand, to be able to decode effectively and really get the message clearly what the client is aiming to communicate. That's so important. And so we attend to the non-verbals as well as the verbals of the message. Now, some benefits of attending fully. Clients feel respected. They feel that you're giving them time and attention. You'll hear when you're attending and be better able to understand the reasons why clients have come for help, obviously. And you'll be in a much stronger position to provide clients with appropriate information that meets their concerns. That's also very important because you're understanding their concerns. So therefore, any responses will usually be on track. And you'll be able to determine whether your service as a counsellor will be likely to help. And if not, you'd be able to make sensible suggestions. And so attending is really quite important. If you don't attend, some disadvantages of not attending, well then you fail to show respect to the client straight away. Because we're demonstrating that we're unwilling to give appropriate time and attention. And we can't know what kind of help the client may require if we're really not paying attention. So we can make broad assumptions. And look, I know this might sound obvious, but it can happen. If we're not listening, if we're not focused in attending properly, we may miss vital information. And in the context of missing that vital information, we can really get off the mark in regard to what the client really needs and the type of help they're looking for. And so really paying attention, whereby the client is really feeling understood, is very important, because we will not be as helpful as a counsellor if we are not effectively attending. So we will be less helpful than we could be. We might even undermine the confidence of the client who might have found it hard to come for help, and then when they come for help find that we're not really interested because we're not attending effectively. So we've got so attending is very important. Okay, we'll move on to the next one, questioning skills. Just an overview, or just giving you an introductory overview to all of these things. You can see how each one of these micro skills really can be focused on very specifically, each one individually, but I'd just like to discuss and give an introductory overview to them. So now questioning skills. One of the spoilers is excessive questioning, but then questioning when used effectively is a great thing in the communication process. The reason that you would question in the therapeutic process is it helps to guide the counselling conversation by assisting to enrich the client's story, because questions can encourage the client to elaborate. It can help the counsellor understand, because you obtain further information from the client by asking questions. You can have things clarified that's already been shared by asking questions. You can encourage the client to continue speaking, and you can help sharpen the thinking around certain points when zeroing in and asking questions. So questioning can be quite a good thing. But then again, with questioning, if poorly done, it can irritate or fluster or create defensiveness in the client. Okay, but if there's a genuine interest in understanding the client, questioning when appropriate will just entice the unfolding of the client's story in a very healthy and vibrant way, giving all the colour. And so it's useful in the information gathering stage of the counselling process, obviously, in getting information and clarity, but it's also used throughout the entire process. So 2 basic types of questions as an introductory overview of what types of questions are used is basically 2 major areas: open type of question and closed type of question. And the open question seeks to answer, or it seeks an answer of more than one word. It's an open-ended question prompts elaboration, which means it's a question that has an open-ended response. And open-ended questions will tend to start with who, what, when, or how. For example, what kind of help would you like for your father? Or how will you decide whether you should stay with your current job or not? How will you decide? And so that's open-ended because it allows for a larger response. Closed questions invite a 1-word or 2-word response, where it's closed in the amount of response that can be given. For example, it's often a yes or no type of response that can happen. So closed questions will tend to start with words like did, or do, or are, or have, or will. Will you, have you, did you, do you, are you. So for example, did your father spend time with you when you were a child? Now there's room to elaborate on that, but the way the question was worded in this example, it would just give an either open or closed, yeah, no, maybe, sort of. And then open-ended questions could prompt for greater elaboration. But another example, have you thought of leaving your current job? So again, another type of question is why question, and why questions tend to put clients on the spot and make them feel that they should justify themselves. Why? So we've got to be careful how and when and the tone in which we use why questions. Sometimes they can be used in a normal part of human dialogue. Asking why doesn't always have to evoke negative responses, but we do have to be careful of why questions. As I was saying, they can create a defensiveness because it's asking the client to explain themselves. Why did this happen? Why did that happen? And so, just as an example of the how, what, when, where, and why questions, how will most often encourage the client to talk about feelings or process. How do you feel about this, or how did you go about that? What questions most often lead to facts and information? What happened there? What was going on here? What did you decide to do? These are just general rules of thumb. When questions will often bring out the timing of a problem, when a situation occurred, and where will encourage discussion about the environment and the situation specifically, and then why questions will bring out reasons. Just some inappropriate types of questions. I've just got 5 examples of inappropriate types of questions to watch out for. And it's these types of questions that can encourage negative responses and have a client feeling uncomfortable. So a bombardment or a grilling of questioning. Too many questions will tend to put clients on the defensive foot, and it might give too much control to the interviewer as well. And then there's a second bad type of question is multiple questions, also known as compound questions. You can confuse a client by throwing too many questions at once or having 2 or 3 questions in the one sentence. So it's another form of bombardment, the multiple questioning. So we need to be able to select the questions and the timing of questions in a way that encourages the client rather than has them, step back. Questions as statements where we actually want to make a statement, but we have it as a question. As a way to, it's a way of selling our own point of view or idea. For example, don't you think it would be helpful if you studied more? Okay, that's really a question. That's a statement disguised as a question. Don't you think it would be helpful if you studied more? It's putting up an argument to the client rather than asking them more. Do you feel you need to study? How much do you feel you need to study in order to achieve what you want to achieve? Those types of things are far better than don't you think it would be helpful if you studied more? So, as an example, so it's not questions as statements or questions and cultural differences. Inappropriate questioning in regard to the client's culture, and we have to be careful of that in terms of what is appropriate to ask according to cultural variations. And then, as I talked about before, another potentially problem question are why questions. Why questions often put the interviewees on the defensive and may cause discomfort because often it will mean they'll have to explain themselves and justify themselves as to why, whatever the question is asking. Okay, so we've looked at attending, we've looked at questioning, and now we're going to look at responding. As a counsellor, when we are responding to what we're hearing, that's important. Okay, so we're attending, we're asking questions that prompt the client to continue to share their story, we're getting clarity of information, the client is feeling heard, our questions are helping us demonstrate our respect for the client, showing our interest in the client. And so responding. What happens with responding? Responding, when we respond to what we're hearing, it can, when used appropriately, it can encourage the client to continue talking. It can open them up to share more, and it informs the client that as a counsellor, we've heard what they've been saying, we see their point of view, we're grasping how they feel in their world as they're experiencing it. And that's really important if we respond in the right way. So the main ways of responding in the initial telling of the story when the client is first sharing is through 3 key micro skills, and that's encourages, paraphrases, and summarising. And we'll just talk about these. But ultimately, in a nutshell, encourages, paraphrases, and summarising as types of responses to what we're hearing the client say. It will help the client feel understood. And if the client feels understood, then we know we're understanding, which is a good thing to check. So encourages is the first one, and then paraphrases, and then summarising. So encourages as a response. Encourages also can be called intentional listening. It's a variety of verbal and non-verbal ways of prompting the client to continue, to encourage them to continue talking. And so encourages are there to keep the client talking. and for the counsellor to have more influence on the direction as well, possibly. We can encourage a client to talk more about a certain thing if we think it might be relevant or pertinent for them to share a little bit more and elaborate more on that. Obviously, the client should still be in control. If they don't want to share that aspect, they don't want to go there, then we should respect that. But we can encourage the client to elaborate on certain areas more. Types of encouragers include the non-verbal and non-verbal minimal responses such as a nod of the head or positive facial expressions, matching non-verbal behaviour, eye contact as well, silence, speed and tone and volume of speech when we are responding. Those things are non-verbals in regard to actual words said, but they can be the tone of our voice, the speed, the volume, even just noises. Okay, so the verbal responses are the ahas. Please do go on, and even communicating our feelings in there. We can tell me more. Wow. Really? Okay. Yeah. Straightforward, but really important. And if we're engrossed in the client's story and really wanting to understand, that a lot of those things will just springboard naturally from us if we're really in that place of wanting to understand. So they're encouragers. And then paraphrasing as a response. Paraphrasing or reflection of the content of what we are hearing. It's when we choose the most important content details of what the client has just said and reflect it back to them in a clearer way and using our own words. So we've gone through the decoding and we're feeling we're understanding it, so we then paraphrase it back in our own words as a way of being able to see that we're understanding, to clarify that we're getting it. It can just be a few words or a couple of sentences in order to see that we're on the right track and that we're following the client. Now, the difference between paraphrasing and another word thrown around is parroting. Okay, a paraphrase picks out the most important parts of the content to reflect back, whereas parroting is simply repeating back the exact words of the client. Okay, and it's a big difference. If ever practicing paraphrasing, don't just slip into parroting. We need to be able to get the information, digest it, and then give it back to the client in our own words to check to see whether we have really understood and that we're tracking and clarifying that we've got it. And so that's paraphrasing. We'll move on to, I'll just give some examples of paraphrasing. Okay, for example, the client might say, I'm finding work very frustrating at the moment. I'm not sure if I want to stay or go. Okay, a paraphrase could be, okay, so you feel frustrated and you don't know whether to leave your job. Sometimes it's stating the obvious, but in the complexities of dialogue, sometimes it can be good to put in a paraphrase in the midst of what might be being shared. I just don't see how anything is going to change. I just feel like I put all the energy into this relationship. Okay, so you feel the relationship's a bit one-sided. Another one, I'm having difficulty doing even the simplest tasks. I feel zapped of energy ever since my mother died. I spend most of my time just surviving. Yeah, okay, so since your mother's death, you're having difficulty just going through the day, just making it through the day. All right. Another thing that I'd like to add in terms of paraphrasing relates to sentence stems. A sentence stem leads into the paraphrase. So, such as, yes, I hear you say, da 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 da, or let me see if I've got this right. And so those sentence stems can sometimes be a great way to introduce a paraphrase. All right, and now we're looking at summaries as a response. So we've looked at, this is the third that we're looking at. So what are summaries? They're brief statements of longer excerpts from the counselling session and what the client has said. They're summaries of larger chunks, which is different to a paraphrase. In summarising, the counsellor attends to the verbal and the non-verbal content and comments over a period of time, and then pulls together the different parts of the extended communication, restating as accurately as possible. Again, not parroting, but putting it together. So it's phrased at the end. It's a summary, and it's an important component. That's what we're looking at. It's enabling a check of the accuracy of the counsellor in terms of their understanding and their responses. It's checking to see whether, hey, have I got this? I'm just going to summarise. Okay, so what you're saying is, and then we go into everything that we think we've got and how it comes together. So just to summarise why we summarise, to establish the counsellor's presence and make the interaction more two-way. Okay, so it keeps the counsellor engaged when summarising. That's really important. And if the clients are telling their stories really rapidly, counsellors may deliver summaries as a way of calming the client down in terms of saying, okay, let's just take a moment and let me see whether I've got it right what you're saying. And just in asking the client to take a moment, it can calm the client down. Summaries can clarify what clients have communicated, and it's a way of really identifying the themes and the important issues and problems. Okay, so now we're going into another micro skill of noting and reflecting feeling. Noting the feeling and reflecting back the feeling is where you notice and then reflect on the emotion back to the client to show that you understand what they're feeling. So it has similar connotations to a paraphrase, and the process aims to assist in adding the emotional dimension. And reflection of feeling, it should be presented as a statement, not as a question. That's something that's really important. And the main purpose of reflection of feeling, just a few points as to why we reflect feeling, to help the clients identify and clarify and then express their feeling. That's important. To help clients explore their feelings more deeply is another reason. And clients often will have difficulty identifying and accepting their feelings on their own, and so coming to a place of acceptance of what they really feel often comes about when it's reflected back. And it can be a revelation often where the client will go, yeah, that's it. Yeah, that's what I'm feeling. Yeah, and so they can really get to identify and accept their feelings. Reflection of feelings can also model an expression of feeling. When we reflect it, we can also model a feeling ourselves in the reflection. Gee, that must have you feeling angry. You just seem, you're just so angry with that. It's wow, And so even that's just communicating an acceptance and a connection with it as well in a modelling sort of way. Many people have an experience of an emotion, but they don't have a label for it, and so their encoding of it in order to present it hasn't really happened. It could be quite a complex emotion. It could be an emotion that they haven't experienced before and therefore don't have a label for it. It's an emotion that they might not understand, and so reflection helps in the encoding so that then the client gets a better understanding themselves. it helps them then not to feel as afraid of the feeling when it's reflected back, and it's actually, they can see it clearer, which can take away the fear of it as well. And it also helps the client feel accepted when we're reflecting back the feeling, that we're saying that we see it, we understand it, and we're accepting it when we're reflecting it back. Sources where clues regarding the client's feelings can be found. So where can we pick up on how the client is feeling? Well, a client can directly express their feelings, and sometimes clients will be completely aware of how they feel and will be able to encode it and communicate it very, very effectively and openly. And so in this case, a counsellor may just use another word to describe the feeling, so that the client can begin to express feelings at a deeper level. So when they are expressing feelings, a reflection back in that instance might be just to bring them into a deeper connection with it. The verbal content, a client may not be mentioning the feeling directly, but it may be possible to infer what they're feeling from the client's words. Often metaphors can be used to express a feeling without actually stating the feeling itself. For example, just running around like a chook with no head. Reflect back. You're sounding really stressed. Okay, and so it's those sorts of things in regard to verbal content. Non-verbal behaviour, how the client appears to be feeling, is another source. You know, the disposition in their physical and behavioural demeanour can pick up. You can pick up things on sadness or anger or frustration or anxiety without being said, but in body language as well, non-verbals. Even in, again, you know, without the words, but the tone of the voice and the speed of the voice and those sorts of things. And then projection of the counsellor's feelings. Detecting feelings, we can sometimes pick up a feeling when we feel it in ourselves, when we start to think, okay, well, it doesn't always work, but this is just another way. It's sort of, how would I be feeling if I was in that situation? And that's where often a reflection back could be, wow, you know, you just must be feeling so angry. Man, you just must be so angry. And that could just be coming from a projection of our own feelings where, you know, what would I be feeling? That's a good way. I mean, the thing is that with a reflection, if you don't get it right, it's not a big deal, because, you know, it's open and honest dialogue, and it's a journey shared together to establish understanding. And so, you know, we don't want to be like neurotic perfectionists in trying to get every reflection completely accurate. You know, we have to be open to having our reflections and our paraphrases and so forth being corrected, where the client might say, no, I'm not angry, frustrated or disappointed, you know, and then it's like, oh, really disappointed. Explain that further. How are you disappointed, you know? And that's the journey shared in gaining understanding and moving deeper into the emotion. So even an inaccurately reflected emotion can be a great tool through which the client discovers what they're really feeling, because they can say, no, it's not actually that, but yeah, it's more this. Okay, so that's the reflecting, and now we're going to move on to observation. So observation, this is a fundamental skill in counselling, and it's used throughout the entire counselling interview to observe. To observe and become aware of not only the client's verbal and non-verbal behaviour, but also our own stuff, where we're observing the client and observing ourselves, observing body language, tone of voice, facial expressions. Effective observations will pick up on discrepancies and incongruences in the verbal and non-verbal behaviour. And discrepancies observed, they're often an indication that the client's confused or having some conflict, or there's an issue around that incongruence in some way. Now, observations of discrepancies, they can provide opportunity for the counsellor it's often at the fulcrum of change where there's an incongruency. And so it's in that place of observing an incongruence where growth and self-awareness in the client can emerge. So to highlight discrepancies as a consequence of our observations, we need to be sharp, we need to have a well-developed client-counsellor relationship so that there's an openness of sharing from the client, so we get a clear view of who the client is, so that indiscrepancies can stand out more, and also timing to turn the observed discrepancy into a positive possibility for growth when it's picked up. So 3 types of behaviours that a counsellor might observe: the counsellor and the client's non-verbal behaviour, the counsellor and the client's verbal behaviour, and any discrepancies or conflicts or incongruencies between the counsellor and the client too. So it's within the counsellor, within the client, and also between the client and counsellor. So some of the non-verbal behaviours: bodily behaviour, the posture, the body movements might be incongruent with what's being said. Yeah, I'm really happy. Couldn't feel better. Body language, voice, incongruence. Facial expressions, smiles and frowns, that sort of stuff. The voice-related behaviour, the tone of voice and so forth. There could be observable physiological responses like blushing and sweating that could stand out, or physical characteristics in terms of grooming, those types of things as well. So the client observation skills, they can pick up discrepancies in the therapist too. That's really quite important. And so we need to check out discrepancies in ourselves and the message that might be sending to the client. How is our body language being read by our clients? Often people who are communicating well together will mirror each other's body language. That doesn't always happen, but often if communication is going well, you might actually catch your client mirroring you in the way that you're sitting or the way that you're holding your head, or there might be a particular body position you're in and you notice that the client is doing that. Or you might find that within yourself, that you're so engrossed and engaging in the client's story that you find and observe that you're mirroring your client's body language. And often when that's happening, it's showing that there is a natural and open and honest connection happening. Lack of harmony in movement, where there's a mismatching, that can be common between people who disagree, and where there's subtle conflicts. And so you might find, you might even just make a statement where the client, you can just tell, reels back, and you can tell that they're not agreeing through one aspect of their body language, while they're saying that, yeah, okay, and they're verbally saying they agree, but their body language is showing you that they might not. Okay, so that's the observation, observing incongruencies. Again, these are I'm just introducing these. Could spend a whole hour on each one, but we're not. Confrontation. Okay, here's another one. Confrontation. It's a skill that can assist clients to increase their self-awareness. Now, when we're talking about confrontation, in a therapeutic micro-skill way, it is different to confrontation at a nightclub or confrontation in a relationship that is not working too well. We're not talking about what we would normally, in just layman's terms, consider confrontation. We're talking about a therapeutic skill of confrontation, often termed to challenge. But a confrontation is the process of highlighting the discrepancies observed. That's really what confrontation is about. So it's not like confrontation in the normal sense, but it's raising awareness of any mixed messages or incongruencies that as a counsellor you might observe in the client's words, in their behaviour, in their feelings, in their thoughts, and anything that might stand out. And so confrontation should only be used after there is a really healthy rapport built, where trust has been developed, where the client is feeling understood, and the relationship between the client and the counsellor is healthy. Okay, so confrontation helps to enhance the client, enhances their growth and development, because in the incongruencies there's potential for change and growth. So changes in client behaviour that helps them achieve their goals. It could mean changes in their thought patterns that help them achieve their goals, or changes in their feelings, or just a broader self-awareness. So by confronting the client on incongruencies, counsellors can help clients become more aware of the need to clarify their own thoughts and feelings around particular issues. They might be saying one thing but feeling another. They might be feeling something but then behaving in a way that's incongruent to what they're feeling. And so bringing that out is really quite important. And confrontations not only expand the client's awareness, but it can also stimulate the client to give additional information as well. So examples of a confrontation. Here's an example. Okay. So as a counsellor might say, I'm a bit confused here. Earlier you said you had bought an expensive dress, but now you say you're worried about paying your rent, and it seems hard. It seems that it's hard for you to make a clear decision on how to use your money. You've got yourself in a bind there, and so that's picking out a discrepancy straight away. You say you want to spend more time with your family, but you're still putting work ahead of them. Can you see that? Okay, that's another example. So types of inconsistencies to confront. What are some inconsistencies that might crop up? So inconsistencies between the verbal voice and body messages. On the one hand you say that you're nervous but you smile. That could be one thing to bring out. Can you see though how these confrontations need to be immersed in a trusting, mutually respecting therapeutic relationship, where the client is feeling safe and there is a rapport that's been built. Okay, another inconsistency, inconsistencies within verbal messages. You say you're doing poorly, but then you report being in the top 10% of your class. That's a perfectionist, hey? Okay, so there's another incongruency or inconsistencies between words and actions. You say you love your children from your former marriage, but you're behind on your maintenance payments. Okay, so, and confronting it can be when those inconsistencies are presented. Inconsistency between past and present statements. Okay, so you now say you hate her, but just before you were saying how much you loved her. What is it? Explain a little more. And so, again, making the client dive deeper, coming to a point of change and clarification. So in these confrontations, then we move now on to another micro skill of focusing. Focusing enables the counsellor to direct the client's conversational flow into areas that will be more productive, okay? To direct the client into areas that are most pertinent. So focusing involves three important skills. Focusing clients on themselves, initiating focused exploration, and focused responding. So we're going to look at these. We're going to focus on these. We're really doing a broad overview of a lot of things, but it's actually still quite intense, hey? long video, so you might want to turn it off and grab a cuppa and come back, but I'm going to keep going. Helping the client focus on themselves, and then initiating focused exploration, and then the next one is focused responding. So helping the client focus on themselves, encouraging your clients to send iMessages. That's probably the major thing in regard to helping clients to focus on themselves. Okay, I statements, if you haven't heard of this term before, or the meaning of it. When a client is expressing their feelings, to say, I feel angry, I feel sad, I feel happy, I feel excited. To use I helps the client own the emotion and take responsibility for it. Or I think this, or I believe that. If we don't want to own it and we're avoiding accepting that that's how we feel or think or what we believe, then we might just say things like, oh, you know, what do you reckon? You'd feel a bit sad, wouldn't you? Or, you know, I mean, most people would feel pretty angry with that, wouldn't they? You can see there where the use of you or most people or any type of statement at all that's used to distance the person from really owning and embracing what they feel and think. So helping the client to focus on themselves by using I statements can be quite significantly powerful to do that. So 3 ways of encouraging clients to send I messages, you know, where I believe this, I feel this, where they comfortably own who they are. So 3 ways. Respond as though the client is sending I messages. So even though the client might say, well, you know, most people would feel pretty upset with that, wouldn't they? A reflective response back could be, or paraphrasing could be, okay, so you feel pretty upset, or you look pretty upset, or you sound pretty upset. Okay, so even though they're saying, oh, you know, most people would be upset, you can then bring it back onto them, rather than, yeah, most people would, to bring it back. So you're feeling pretty upset. So it's responding as though the client sends the I message. You know, responding to the client in a way that uses the words you as though they'd sent it. Okay, model sending I message. So if we're being open in the therapeutic process, then we have to model. You know, we have to say, I feel this, I think that, I believe that. We need to be able to model it in order to encourage the client to use it as well. And then a third is to just outright ask the client to use iMessages, to point it out to them that they seem to be disowning and distancing themselves. This could be an effective confrontation. To request the use of the first person singular. You know, if a client repeatedly fails to send the iMessage, you know, then openly drawing this to their attention is important. But you have to be careful, you know, in when you do that and how you do that. So initiating focused exploration is the next. So helping the client focus on themselves. Another point of focus is initiating focused exploration. Okay. This is where you ask clients to prioritise areas of exploration. Yep. Example questions to initiate focused exploration, because you know there can often be a lot of things that are being discussed and shared and opened up about, and so it's, you know, there's the time to focus and zero in, and so getting the client, you know, so for example, okay, you've identified a few areas of concern, including your marriage breakup, the problems with your children, and work issues. Some very significant things, you know, that you know, are causing you a lot of pain. So what areas would you like to concentrate on first? Okay, so that's initiating focused exploration. Another example. Okay, of the areas that you've mentioned, which area would you like to spend time on first? And another example. wow, that's quite a list. There's a lot of things there that you want to focus on, which is great. You really want to work on a lot of changes, but what would you like to work on first? Okay, so you can see there ways of just encouraging the client to focus their exploration. And now, focused responding. Client statements often have a lot of parts, and so therefore we have to choose which part to respond to. So that's focused responding. And again, it's focusing intentionally onto key areas of therapeutic work. So for example, the counsellor may choose to focus their responses in regard to what a client has said. We might choose to focus our responses, which could be a reflection or a paraphrase or whatever, on the feelings expressed, on the feelings and then the thinking behind the feelings. We could focus on the problems themselves and the pragmatics around it, or the situation around it. We might focus on the other person or persons that have been communicated through the process in it. Might focus on the counsellor or the environment. Now I'm going to give the environment and situation and circumstances, and so that's 6 there, and I'm going to give an example of each of the 6. And then after we do that, we're going to move on to influencing the last micro skill. So we've gone through a lot of micro skills here, and so now now I'm going to, now you can download your notes. Obviously you'll be following with your notes, so you can see what we're looking at here. So, okay, examples of each. So the first one, focusing on the feeling. You felt unsure when she said you were sweet. You felt unsure when she said that she thought you were sweet. Okay, so that's focusing on the feeling unsure. Focus on the feeling and thinking behind it. You feel unsure about being seen as sweet because you think it's a bit soft or unmanly, yeah? Okay, that's focusing on the feeling and the thinking behind the feeling. Focusing on the problem. What could you have said to her to let her know it kind of felt right when she put her arm through yours? Okay, so focusing on the problem. What could you have said to let her know that it kind of felt right when she put her arm through yours? Focusing on other people. So, focusing on other people. Tell me what you find hard to tolerate in her, James. What do you find hard? I just use the word James. There's a James out there, hello. And focusing on the counsellor. I personally think it's fine to be called sweet. Okay. Focus on the environmental situation and circumstances. Okay, so what do you see other young guys around your age doing and saying when they're with a girl on a date? So focusing on the environmental situation or context. Or what do you see other young guys doing, around your age? What would they be saying when they're out with a girl on a date? So that's focus response. You could focus on any area there, okay, so now we're moving on to the final micro skill we're looking at is influencing, and again there's a lot of different aspects of this in terms of influencing. So we're going to get stuck into this micro skill, and then we'll have a quick look at the interview process just as an overview, the counselling interview, where these things fall in, all of these micro skills. But so for now, we're looking at influencing. Okay. So when the client's exploring alternative ways of thinking and behaving, then the micro skill of influencing. As a counsellor, you will have an influence on the client, but in the right context and in the right way. And so the goal of influencing is a few goals: to assist in generating new stories and actions from the client. To facilitate change in the way a client chooses to think and act. So it is to facilitate change. Clients will come to counselling because they want to change. And so it's through the process of these influencing micro skills that we can help in that change. Influencing is generally used when the client is exploring alternative ways of thinking and behaving. And these skills, they seek to change the way the client is thinking about themselves or their situation. It will be about the thinking and the feeling and the behaving. What they think about a situation and themselves. And influencing skills, they're designed only when necessary. It's not something to just continually use. And the counsellor should be careful not to fall into the trap of influencing too much and not really attending and being with the client as they're sharing their story. If we just get into influencing, then we can really have the therapeutic relationship disconnected. An example of a situation where we might influence. A young person's just started taking drugs. The counsellor discusses the possible long and short-term consequences of their actions. Okay? So just in discussing the long-term consequences, that is a potential influence. Okay? Particularly if the therapeutic relationship has developed mutual respect and regard for one another. Okay. Now, there's two characteristics of influencing skills which makes them different to attending. Okay, so the counsellor is more proactive and directive, and it promotes change more rapidly. So, 3 steps in the process of influencing. First of all, first step, we have to listen. So listening allows a counsellor to identify how the client thinks, how they're seeing the situation, how they feel about their world, how they see their world. That's the first thing in listening. The second is to assess and influence. We might provide a new frame of reference or maybe an informational base from which the client can then decide to act. There's a few different ways, but we assess and then we influence. And then this third step, and we're going to get into 6 types of influencing skills. We're going to break this down. But and so the third step, though, is check out and observe the consequences of the influence. To observe and evaluate the consequences in the client's responses. Okay, so 6 types of influencing skills. We've got logical consequences, self-disclosure, feedback, information or advice, opinions, instruction, directives, and interpretation or reframing. So we're going to look at these 6. Okay. Then after we look at these 6, I suggest you get a cup of coffee or tea or something, and then we'll just have a very quick overview of the interview process. Okay, so the first, logical consequences. Okay, let's have a think about this. Logical consequences assists the client to become aware of the possible consequences or results of their actions, whether positive or negative, to just communicate them without any statements of judgment, but just the facts of potential consequences of a certain action or behavioural choice. Example, an adolescent girl is considering moving out of home because she's fighting a lot with the parents. She's 14 and a half years of age. And so, just talking about logical consequences. And again, in a trusting relationship where rapport is built and the client knows that you respect them and value them. Okay, so if you move out of home, then you'll have to fully support yourself. You'll have to meet all your own expenses. That'll include food, accommodation and bills. Okay, so is that right? So that's influencing by presenting logical consequences. Self-disclosure is another one. Sharing information about ourselves, our expectations, our attitudes and our feelings in a way that will be beneficial to the client. That's another way of influencing. The main function is to encourage the client through increasing rapport, which is very important in this. The client is likely to feel more understood and supported by the counsellor who has felt similar stresses in similar circumstances, so there can be an added connection in self-disclosure, and that's an influencing skill. Self-disclosure does require, though, that the counsellor share something of themselves, their story and their experience that is relevant and pertinent to what the client is facing and working through. It's got to be genuine, it's got to be timely, and it's got to be phrased in present tense, and it's got to be brief. It's not something that we get engrossed in telling our own stories. It's for the client's benefit. Okay, so self-disclosure as an influencer. Example of appropriate self-disclosure, the client. Okay, my workshop foreman cuts corners on our quality controls. I tell you, our product flaws are on the rise every month. I'm scared to speak out to the manager though. You know, do you know what that feels like? Counsellor. Oh, geez, I was in a similar situation years back. My supervisor in that job was working long hours and making mistakes that affected the clients. You know, I also felt scared to report that supervisor too. That gives an influence. It has a client review what they're doing and how they're going about it, and they can then start to see it a little bit more objectively in the counsellor, a similar situation, and it can have them think of how they might go about it, what they might do, how they might respond. It can have a very subtle, unique impact in that way of influencing. It's appropriate as a self-disclosure because it's brief. It shows the client that the counsellor experienced a similar situation with a superior in a workplace. And if it's too long, if it's too detailed, if it doesn't disclose the counsellor's feelings, and it has a lot of negative conclusions, then it's not appropriate. Okay. Now, information giving can be another form of influencer, and we'll just have a look. It's verbal communication by the counsellor to the client of facts, of data, about people, activities, events, resources, those sorts of things that can really just help to influence as well. So information giving can be used to help the client choose the best alternative. You know, well, here are the options. Here are the possibilities in regard to some cold hard facts. Just some information. The following is an example. The client, I'd really like to meet new people, especially someone in the same situation as me. Counsellor, well, there's a women's group that meets at the local community hall on a Tuesday afternoon. They've got different craft activities every week. It's free and newcomers are always welcome. Now, by giving that information, that influences big time if the client chooses to take it up and go. When giving information, it's got to be data and facts and relevant to the client's needs. And we have to ensure that the client is receptive to the information. We've got to be direct, clear and specific. We've got to be concrete with the information. And we've got to break the information down so that it's into its parts, so it's easy to understand. And if the client wants to use that information, they can easily. And after giving information, we've got to check that the client's attended and that they understand the facts clearly. And then we have to evaluate for any distortions that they might have about the facts. Okay, so we give information to to present feedback, to give alternative perspectives, to direct clients to other resources, to provide instruction and directions. orient the clients to the interview process as well, where we can give information in that sense. So a lot of reasons why we give information. Now, the interpreting and the reframing as an influencer. Interpreting and reframing, and this is the last one. And then we've finished talking about micro skills. We've covered a lot of ground, and again, we've only introduced them, given you just a quick introduction. Each of these micro skills, you can practice and work on them quite a bit. Okay, so interpreting or reframing. Interpretations, when the counsellor interprets, it provides an alternative frame of reference or perspective for the events in the client's life, and it's based on what the client is saying. Interpretations need to reflect the client's values and not the counsellor's. That's really important. And the purpose of the interpretation, it's to help the client understand the situation from a different perspective. And that can be quite a significant influencer. So to interpret can be quite complex. And unlike most other interviewing skills, to interpret comes from the interviewer's perspective rather than the client's, but with respect to the client's values. And so we're putting another perspective out there for the client to consider. We need to interpret with caution, and we shouldn't try to get caught up in being, oh, wise one, whereby our interpretations always need to be correct. Again, just like with reflecting and paraphrasing, the client can reject the interpretation and not consider it as a viable alternative. For sure, we just put them out there for the client rather than forcing them into them. So before using the skill of interpreting with a client, the interviewer should consider the client's self-esteem, whereby, do they have enough sort of value of themselves to reject an alternative perspective? Or if an alternative perspective is given, do they feel that, geez, their perspective must be wrong, therefore they need to take on that? The client needs to have a sense of valuing themselves so that they can hold the perspectives equally in order to consider them accurately. And then also the ability to understand and use interpretation. We need to have an ability to use it. And we need to be careful about the level of emotional distress that an interpretation might cause. We have to be careful of that and use interpretation carefully in the context of how it might evoke certain emotional responses and within the client. And not all clients will profit from interpretation or reframing. So 4 steps. We have to listen. We have to think of other reasonable explanations. We then have to clearly describe the alternative explanation. And then preface the interpretive statement with a supporting response, okay? We need to show a supporting response before moving into an interpretation. So there are 4 points. Listen, think of other reasonable explanations, clearly describe those explanations, but preface the interpretation with a supporting response. Okay, so the client, here's an example. I've put on so much weight over the last few years that my doctor's saying it's a really big health risk. I want to lose weight, but I just can't seem to do anything about it. Counsellor, I can understand why you may feel frustrated. Perhaps you do want to lose weight, but are you feeling uncertain about how to get started? Okay, so you can see there that I can understand why you may feel frustrated. Perhaps you do want to lose weight, but are you feeling uncertain about how to get started? Okay, so there's supporting responses mixed in with that. Okay, so the client here is saying, I put on so much weight, I just can't seem to do anything about it. I can't seem to do anything about it. So it's a reframing of the perspective that the client has of themselves and of their situation. They feel they can't do anything about it, It's a great health risk. The doctor's telling them they've got to change, but they can't do anything about it. And so a reframing or an interpreting a different perspective. I can understand why you may feel frustrated. Okay, so it's affirming, it's supporting. I can understand why you may feel frustrated. But perhaps you do want to change. Perhaps you do want to. But, are you feeling uncertain about how to get started? But you might just be feeling uncertain about how to get started. And that's reframing it. So it's not that you can't do anything about it. It's more that you just really are unsure about how to get started. Okay, so that's a reframing that can then result in change. Okay, so there we have it in regard to the micro skills. So we've gone through the 2 sections, and now just very briefly, okay, we'll go through the third, the counselling interview, to see where these all fit in. But the first, communicating effectively, the encoding, the decoding, the spoilers, the negative responses, those sorts of things we looked at. Then with the second section, in terms of micro skills, attending, questioning, responding, noting and reflecting, client observation, confronting, focusing and influencing. We've looked at that. And now the counselling interview and the 5 stages. Rapport and structuring, gathering information, determining outcomes, exploring alternatives, and then confronting incongruencies, and then generalisation, and we'll just have a look, and transferring. We'll look at these. Okay. Very quickly, the counselling process, the counselling interview, just stages, and they're called stages, steps, progressive sections. It really doesn't matter what they're called, but they're stages that we go through when in a relational dialogue with a client. Okay, so rapport and structuring. So the initial rapport building needs to be established with the client, and it can be done in various ways, using the client's name, using encouraging non-verbal behaviour, all of the micro skills of attending and paraphrasing and reflecting helps to continually build rapport, emulating a sense of respect for the client and a sense of value for who they are, those types of things, maintaining eye contact, a whole range of different things to build rapport. And also, the observing the client is important too. Is the client relaxed? Are they engaging in the process? Are they responding positively to your attempts to communicate your value and respect and your understanding of the situation they're in? So that's important. So that's the building of rapport. The gathering of information in stage 2, defining the problem and identifying assets. Okay, gathering information where you define the problem and also identify assets that the client brings. It's got to be balanced like that all the time. Reviewing the issue while clarifying what the client has to deal with it effectively. And so, the counsellor's central task during stage 2 is to define the issues and then also bring out the attributes that the client has. And so that's the second stage. Then the third stage is determining outcomes. And the third stage focuses on client goals. The client seeking counselling for vocational, personal or social issues. So determining outcomes and by establishing where they are now and where they would like to be, the counsellor can assist the client in clarifying the issue at hand that has them in the place they are, and assist the client to develop and take the steps to where they want to be. So determining the outcomes is very important. Where in stage 2 you're gathering the information, defining the problem. In stage 3 you're determining outcomes. And determining the outcomes allows the client and counsellor to define, what the client wants to ensure that they head in the same direction, And then stage 4, it's exploring the alternatives and confronting client incongruencies. So in exploring the alternatives, you look at the options that are available to the client, the possibilities for change and future opportunities. And then in confronting the incongruencies, we've talked about this in the micro skills, but confrontations are used to expand the client's awareness and inconsistencies within them. And so it's at stage 4 where that really comes out after the rapport has been built, information has been gathered, assets have been identified, and outcomes have been determined. Once all of that's occurred, then looking at the inconsistencies and the incongruencies, and also continuing to explore alternatives. And then the 5th stage is generalisation and transferring of learning, being able to take what's being learnt out into the real world. So it's discussing ways to maximise the possibility of the new thoughts, feelings and behaviours, how they can go out into everyday life. And so taking new behaviours into everyday life is quite difficult. And so that process of getting the client to do that can take some time, depending on how entrenched old behaviours, thoughts, feelings are. It's that process. So how to do that? Here are just some examples or ways of having the client practice moving new skills, new ways of doing things, new ways of thinking, how to get that into the real world, not just in the therapeutic room. Role play is one way. The more the client role plays the new behaviours, role plays new thinking, new ways of responding, that's a way of priming the client to be able to execute those things in the real world. Behavioural charting and progress notes can also be very important for the client to chart the progress in them successfully executing behaviours in the real world and coming back and reporting on that and then debriefing over that is another important way. Homework, just homework where it's set, whereby the client goes out with specific tasks to practice new ways of thinking, new ways of behaving. And then follow-up and support is also very important, where in this latter stage, in the latter part of the latter stage, the follow-up and support, where there is a checking in to see how the client is going and continuing on and building strength in the new behaviours and the new ways of thinking out in the real world. And so there's that that term and time of support that needs to happen. And so there's just an overview of stages of the interview process to give you an idea of how the micro skills and the communication process that I talked about earlier, where they sort of fit in as just a general rule of thumb, as an introduction to communication as a tool within the therapeutic process, and then an overview of the counselling interview as an introductory idea. Well, I hope that you've gained something out of the information that I've talked about with you, and I look forward to next time. It's always a treat. Okay, see ya.